Right, for you is Dr. Jane Morgan, cardiologist and vice president of medical affairs at Hello Hot. Doctor, thanks for being with us. All right, walk us through. I'm not even going to try to say the name of the drug. We'll leave that up to you. What is it and how does it work and what are your thoughts? Obviously, there's a healthy amount of skepticism. Anytime I hear medical advice in TikTok, I get a little bit nervous.
Red flags go off. Yeah.
As you should. But thanks for having me, Steve and Natasha. So the drug is spironolactone, and it's actually a very old drug in cardiology. We use it a lot to control blood pressure because it blocks a hormone called aldosterone. But it turns out it also blocks androgen, which is another way of saying testosterone. And it's androgen that can produce oil in the skin, clog your pores, cause that acne.
I've spoken to some dermatologists here in New York who swear by it. They're prescribing it. They see before and afters. What have you been seeing with patients?
You know, it's one of those things that dermatologists have had hidden in their back pockets for a while that they pull out. And so they are actually quite comfortable using it, especially in women, especially with androgen-driven or hormonal types of acne, especially if it's painful or very resistant. And when we say hormonal, oftentimes it occurs, you know, in the jawline or occurs cyclically with menstrual cycles. And so it's been quite effective for dermatologists for a while.
You know, I guess the big comparison here, the one we've all heard of, is Accutane for people, you know, in high school who maybe have severe acne. We know that's a very intense drug to take. So the deal is this one's a little bit easier on the system. Is that an accurate way to put it?
It is an accurate way. It's a little easier. I mean, Accutane is a big deal. It's a big ordeal, and it also, you know, can be quite harsh. But, you know, let's be clear. Every medication, no matter how benign, has some side effects. And spironolactone probably should not be used in men or boys because it blocks androgen. And this is what men have in their bodies, testosterone. And so if you start to block that, men can develop gynecomastia, meaning breast enlargement or breast tenderness, sometimes decreased libido, erectile dysfunction. Doesn't mean men can't use it, but we use it less commonly. It's generally used more so in women.
And so because this is a drug that's used for blood pressure, something you definitely need to talk to your doctor about before taking it. And you have to get it prescribed anyways.
You know, you absolutely do. The way it works with blood pressure is it causes you to lose water. It blocks aldosterone, which is a hormone that helps you retain water. So it blocks that, so you lose water. You get that diuresis. But the side effects are your blood pressure could drop. You could feel dizzy. You could also have an increase in potassium levels that increases your risk of cardiac arrhythmias. So you always want to take these medications with your doctor's advice.
Okay, the one-time TikTok actually had some shred of truth.
So the info might be all right. All right, but yeah, check in with your doctor as always before you actually get involved with any new medication. We appreciate it. All right, Dr. Morgan, thanks so much.